Okay, so we've done our acupressure points and you've got pain relief, which is great. But here's the thing about lower back pain. The root of the problem, like I said earlier at the beginning of the module, is it's most likely coming from too much stress on the joints from overweight, or your core is weak, or it could be postural issues. So one thing I recommend to all my back pain patients is some exercises. So right now we'll go over a few exercises that I show my patients. And one precaution is if any of this starts to hurt or if it feels uncomfortable at any point, just stop right away. If you have sciatica or you have numbness in the legs or tingling down the back of the leg, on the side of the leg and the toes, just stop right away. So this first set of exercises that I'm going to talk about are called back bridges. So you've probably seen these at your physio or on YouTube somewhere, but these are really great exercises. I do strongly recommend people doing them that have lower back pain once you're out of the acute pain. When you're in acute pain, sometimes doing exercises actually aggravates it. So once you've reduce the inflammation with your acupressure points, you can actually start about strengthening and working on posture as well. So first things first, you kind of put your knees on the side. You can put your knees together actually. So over here, and I'm just gonna lay down flat. And as I'm flat, my hands are just on my sides, nice and relaxed. And I'm just gonna take a deep breath in. Okay, take one deep breath in, and as I breathe out, I'm just gonna raise and push off my buttock, push off my feet, and then raise my tailbone as high as I can. And I'm just gonna feel these muscles here stretch a little bit. You may feel some in the glute as well, which is very normal. And I'm just gonna hold for 2 seconds after I reach the top and I can't go anymore. So make sure you don't go here, kind of like these lazy half ones. You wanna press all the way up as high as you can, hold it. You can even have a partner spot you, like when you're benching, you have someone hold it up for you. Hold it here, just hold for 1 Mississippi, 2 Mississippi, and come down. So I'm gonna hold, and deep breath in, and deep breath out. As high as I can, and I'm just gonna hold it. 1 Mississippi, 2 Mississippi, and come on down. Breathe in, and breathe out, up as high as you can, hold it. 1 Mississippi, 2 Mississippi, and come back down. Deep breath in, and deep breath out. 1 Mississippi, 2 Mississippi, and come on down. So these are back bridges. I do recommend you start off slow. So say even try 1 set of 5 and see how you feel. And you can actually gradually build yourself up to 3 sets of 5 or 3 sets of 10. So slowly, first week 5, second week 10, third week 15, and just see how you go as you progress along. So again, if it hurts, just stop right away. So this is meant for you to do after the lower back pain has stopped. Okay. Second exercise, these are called hip rotations. So again, I'm on my back here, take a deep breath and breathe out. I got my knees together. I'm just gonna turn all the way to the side, and I'm just gonna feel this nice stretch on my lower back and through here. Deep breath in and breathe out. Again, I'm just gonna rotate to the other side, rotate my hips. Again, I'm feeling over here. Sometimes you might feel like a crack, or kind of like when you're at the chiropractor. That's completely normal. You shouldn't feel any pain right here. You should feel a nice stretch. So deep breath in, and breathe out. Hold that for 2 seconds. 1 Mississippi, 2 Mississippi, deep breath in, and deep breath out. Rotate to the other side. 1 Mississippi, 2 Mississippi, deep breath in, and breathe out. Yep. And one last one, deep breath in, and deep breath out. So these are your hip rotations. You can do them, same thing, you can incorporate, you can just start off with 2 sets of 5, left, right, left, right. You can do up to 10 times. You can do for 2 minutes straight, or we can work up to it as well. So I would start, say, 2 sets of 5 along with the back bridges as well. Okay, last set of exercises. These ones are called, this is something I actually picked up from my teacher in China. He used to call them ballerina. I don't know what the technical term is, but pretty much you've got your leg up and toes straightened like a ballerina, so I guess that's why they're called ballerinas. So, on my stomach, and I'm just gonna have my arms over here,
And what I'm going to do is I'm just going to lift up forward, and I'm just going to point my toes, and I'm going to point it at a 45-degree angle toward the opposite wall. And come back down, deep breath in, and breathe out, opposite leg, lift up, and opposite wall. And come back down, deep breath, and breathe out, opposite corner. And deep breath in, come up, opposite corner over here. Make sure the toes are not like that lazy, it's pointed up toward. And I'm going to feel this muscle here being activated. And this is actually really great for lower back pain with disc problems as well. It really strengthens the discs over as well. So here, point, and here, point, deep breath in, hold. 1 Mississippi, 2 Mississippi, come back down, lift the other leg, breathe out. 1 Mississippi, 2 Mississippi, and come back down.
So, as always, start off slow. Just try 2 sets of 10. See how you feel. So you want to build up to it. So right now you've got back bridges, you've got hip rotations, and you've got ballerinas. And these are usually the 3 most common exercises I do recommend for patients. This is for lower back strain, and it also helps your posture as well. So this is a lower back pain module.